Welcome to Season 18 of Marrow Masters, produced for the National Bone Marrow Transplant Link and sponsored by Sanofi and Jazz Pharmaceuticals. This season is all about the caregivers. Our guests will offer up their best tips, experiences, and advice. We'll cover the importance of self-care and share heartwarming stories of compassion and love. Now, here's your host, Executive Director of the NBMT Link, Peggy Burkhardt.
Well, hello, everyone. So today we have with us Anastasia Cacavias, a registered nurse and manager in the Blood and Marrow Transplant Leukemia program at Northside Hospital Cancer Institute in Atlanta. So Anastasia is going to share with us today her clinical perspective regarding caregiving as she sees it on the daily. So let's get started. Welcome, Anastasia.
Hi, thank you so much for having me here today. I'm so excited to speak about my experience in transplant. Just a little bit of background about me. I am the manager of the cellular therapy coordinators here at Northside Hospital. I've been with Northside for about 11 years now.
Okay.
I primarily oversee coordinators who coordinate the transplants for these patients. Not only do they coordinate transplants, but they also assist with finding donors for these patients, etc.
Oh, that's exciting. I didn't realize that with the donor aspect. Wow.
Yes.
So Anastasia, share with us what you think about caregiving and what you think people should know.
So in our program, caregivers play a huge role. This person is someone who provides physical care, transportation, emotional support for our patients 24 hours a day, 7 days a week through the entire transplant process. They also are heavily involved with medication management of the patient to ensure that the patients take all their medications on time. It's crucially important that patients take their medications as prescribed, which include immunosuppressants, antivirals, antifungals, etc. Caregivers also play a vital role in symptom monitoring. So when the patients are not here with us in clinic daily, their caregiver is responsible to call our office for any type of symptoms that they may be experiencing at home. Our caregivers go through a thorough education session with the coordinator prior to the patient starting their conditioning regimen. They're educated on watching for signs for allogeneic transplants, any sign of infection, any signs of graft-versus-host disease, or any other complications that they're educated on to notify the medical team. They also play a huge vital role in coordinating their care. They attend all the appointments with the patients. They communicate with the healthcare team, any issues that they're having. They track patients' lab work, test results, and are in charge of all their follow-up care and ensuring that the patient attends all of these appointments.
So that's a lot. They have a lot to contend with.
It's a big role.
For sure. So Anastasia, once a patient leaves the hospital, I'm sure the caregiver now feels even more pressure at home because they don't have the support of the medical staff. Can you share tips on getting situated at home?
Absolutely. And like I said earlier, our caregivers are educated. We have an education notebook they are presented with too, so that way they have physical copies of all the education as well. But one of the big things is we assure that the patient, that they maintain the home environment, that they keep the home very clean. Caregivers also involved in preparing all the patient's food. We educate the caregiver and patient to make sure that proper hand washing is enforced to prevent infections, when we would like them to wear their mask, and also limiting visitors just to help protect our patients' weakened immune system. They assist with activities of daily living. They help the patient get dressed. They may have to help the patient bathe. They may have to help the patient physically with their food, just because lots of times post-transplant, patients can feel weak, they can feel fatigued, and that's one of the roles that the caregiver can assist with.
So this is a perfect segue to my next question. With all this on their plate, they need some self-care. The caregiver needs some time to rejuvenate and get ready to do it all over again the next day often. What are some best tips for trying to get that self-care at a time that it's not really easy to think about yourself?
Absolutely. Caregiving in itself, it's physically and it's emotionally demanding. I think one of the biggest things for caregivers is that they should acknowledge their emotions and express when they are overwhelmed, that it is okay to say that I am overwhelmed and that I need some help. They have to take care of themselves and their loved ones. Well, I always tell my patients, we're not only taking care of the patient, but we feel like we have to take care of the caregiver too.
Ah, that's nice.
I encourage caregivers to take breaks. We have several patients because we do a lot of our care outpatient. And so we always encourage caregivers as well. If you have family members, church members, anyone who wants to come and help, one of the things that I always suggest is to let another family member or another friend bring that patient to clinic that day, just to give them 4 or 5 hours of just some break time.
Sure.
We tell our caregivers they need to make sure that they also get plenty of rest, that they maintain a healthy diet, to always bring snacks here in the clinic. Again, I stress to take the mini breaks. Any type of break that they can get is extremely helpful. It's also big that they stay organized and that they are aware of resources that are around them that can help out as well. I also think, too, it's important for caregivers to continue to stay connected with their friends and their family as well.
Yes, that gives them the energy they need and the socialization they need, actually.
Yes.
One of my favorite survivors told a story in his book, actually, about a friend who came over and took the patient, the survivor, away for the day so that his wife, the caregiver, just even had the house to herself for the day. They took a drive and she just got to be home and just relax by herself with no responsibilities for the day. And I thought, what a gift that was to his friend and to his friend's wife, the caregiver.
Absolutely.
So Anastasia, let's talk about the patient, their needs, and anything we might not have covered on the way the caregiver can help.
Sure. So one of the biggest things that we educate the caregiver is when our patients are not physically here with us, what warrants a phone call, whether it's after hours. Our program, we have our physicians are on call 24/7. So we educate our patients and caregivers. We would rather know than not know. So one of the biggest things that we educate them on is any type of post-transplant complication that needs to be warranted in the middle of the night. For example, fever, any new shortness of breath, any vision changes, any skin changes, if a patient falls, any stool changes, nausea, vomiting, diarrhea, anything that is not being controlled at home, we educate them to call. Because like I said, we have physicians who are on call 24/7.
Very important.
Also, we educate, and I think I touched base on this a little bit earlier, especially for the patient, they need to maintain their healthy food diet. So we have a whole list of foods that they can eat, not eat. That's one of the biggest questions. Patients and caregivers ask me, well, what can he eat? And honestly, post-transplant, I tell my patients, whatever you have an appetite for, eat it. As long as it's cooked, it's not raw, and patients don't feel like eating. We always educate them just to eat anything with a bunch of high protein that would help rebuild their muscle strength. And hydration is the key. Water, 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 water is key for our patients to stay hydrated. We also do a big education session on infection prevention, good hand washing, when our patients need to wear their mask when they leave their home to come here to our clinic. Their mask, as far as the caregiver and the patient, stays on at all times. We educate that our patients have to avoid large crowds. We don't want them around anyone who's been sick, and really stress the importance of maintaining a clean home environment.
That is so true. Anastasia, one thing we hear a lot about is dental issues. I think it's so important to talk about what can happen and ways to prevent decay and even tooth loss.
Yes. If our patients can prior to transplant, we would like for them to have a proper dental cleaning, visit with their dentist. There are times where patients have been in and out of chemotherapy and they just have not been able to reach their dentist. But maintaining proper mouth care is extremely important. Some things that we tell our patients, especially post-transplant, is to make sure they brush their teeth after breakfast, lunch, and dinner, to use a soft bristle toothbrush.
Okay.
There's a mouthwash that we prescribe to our patients and really stress the importance of completing that mouthwash as prescribed.
Let me ask you, is it magic mouthwash?
So Magic Mouthwash is one of the mouthwashes that is out there that patients can use. We really generally tell our patients just to make sure they use an alcohol-free mouthwash.
Okay.
That's the big thing.
Yes, because the alcohol is very drying. Is it taking away the moisture?
Yes.
Okay, thank you for that. So let's move on to mobility. Any advice for patients and their caregivers regarding moving, keeping moving?
Yes. Staying active is huge during this process. We try to get our patients to be as strong as they can before going into transplant. All of our patients receive a physical therapy and occutherapy consultation prior to the start of their conditioning regimen. And this consultation is very specific to our transplant patients.
Okay.
Once they complete their consultation, they are given exercises to perform post-transplant. And it's nice to be able to have a baseline of how they are pre-transplant physically, because if they become extremely weakened, then we know what that original transplant baseline was and how we can get them back to their original state. We also stress the importance when our patients are in the hospital. We like for them to walk laps around the unit. I can't remember off the top of my head how many laps it is for 1 mile, but we really encourage patients to walk when they're inpatient, when they're here in the clinic. You know, I always tell my patients, when you get up to go to the bathroom, walk a lap, walk
Yep.
2 laps.
Great advice.
Make a goal and try to keep that goal. But I also tell them to make a realistic goal as well,
Mm-hmm.
which I think is big. And especially now in the fall, the nice weather that we have here in Atlanta, I tell my patients, if you want to go outside and walk in your neighborhood in the evenings, it's so nice. Go get some fresh air and just stay active.
Yes, that fresh air is so important.
It is.
And it's time together,
Absolutely.
taking a walk together instead of it just feeling like it's all about the patient caregiver. That's just fun to take a walk together, I would imagine.
Yes.
So Anastasia, can you tell us a little bit more about how important that open communication is?
When you have open communication with your caregiver, with the patient and the medical team, that builds trust within the entire team. Patients and caregivers, they will feel valued when there's open communication. And I think it goes a long way when caregivers and patients, when they fully understand the plan of care and medications that they're prescribed, then they're more likely to follow through with their plan. Open communication, I feel like, also reduces anxiety and fear. So we stress the importance of our patients and caregivers to ask us as many questions as possible.
So Anastasia, when an allogeneic transplant takes place, acute and chronic graft-versus-host disease are always a possibility. Can you tell us about GVHD and how you guide your patients and caregivers?
Yes, as we all know, graft-versus-host disease can occur after an allogeneic stem cell transplant. And basically, it's when the donor's immune cells, which is the graft, will attack the recipient, the host's body. There's 2 types of GVHD. Acute can happen within the first 100 days post-transplant. And then there's chronic, which happens after 100 days post-transplant. We educate our patients and caregivers to always be on the lookout of any signs of GVHD, and we educate them to report those immediately to our clinic. Some signs of GVHD, patients can develop a skin rash, they can develop abdominal pain, diarrhea, nausea. In order to help treat or prevent GVHD, we do place our patients on prophylactic medications that involve immune suppression drugs. These drugs are based on their donor type, what type of conditioning regimen they are receiving, and then just our program protocols.
Okay.
Prior to transplant, our patients are educated on GVHD. And then we also continue these discussions post-transplant. Our center has a dedicated GVHD nurse that follows these patients. They normally meet with our GVHD nurse around their day 100 appointment, and she performs an assessment. And then if in the midst of their post-transplant, they develop GVHD, then she follows those patients and is involved in coordinating their care.
Oh, that's wonderful.
Yes.
So, Anastasia, another post-transplant disease to look out for is Veno-Occlusive disease, also known as VOD. Can you tell us what caregivers and patients need to look for?
Yes, so we also educate our patients on VOD, which is a condition in which the small veins in their liver can become blocked. VOD can happen pretty early on in the first 21 days post-transplant, especially for patients who've received a myeloablative conditioning regimen. Some causes of VOD could be, like I said, either their chemotherapy or radiation regimen, if they had any pre-existing liver disease. Signs that we tell them to look out for could be any fluid retention. On exam, they could have an enlarged liver, their skin color can change, or we can start to detect this in their lab work.
Okay.
And if a patient is diagnosed with VOD, then we treat, supportive care, and we treat it with medications as needed.
Very good. So, Anastasia, you see it all. Is there a story that you could share with us today about a caregiver or two who really touched your heart? Something maybe that they did that made an impact on you?
Yes. I was into coordinating probably my second year here at Northside. A patient of mine who was a young female who was actually a nurse.
Okay.
And she was diagnosed with acute leukemia and needed to have a transplant. And she was assigned to my physician. And when we got all of her testing back with all of her leukemia workup, it was noted that she needed to have a transplant. So unfortunately, she didn't have any siblings, or she had antibodies to her parents. So we had to look for a donor through the unrelated donor registry, which we work very closely with the NMDP. During the process, her husband never left her side. He also had a medical background as well, but he never left her side. He was a true caregiver. Like everything that we talked about previously, he was very open to communication, voiced how he was feeling. He accepted the help when he was overwhelmed. And at the end of the day, she was in a remission, and I believe now she's probably 5 or 6 years out from her transplant. So one of the things that I remember, not only was he just this wonderful caregiver, but when she was finished, during the process, they had shared a milestone wedding anniversary. And they always said that they would take a trip to Europe. Her donor, who was through the National Donor Registry, once you're outside of transplant for a certain time period, you can actually make contact with your donor. So for their wedding anniversary, her husband surprised her with a trip to Europe. And not only did he surprise her with a trip to Europe, but one of the countries that they visited, they had made contact with her donor. So when she arrived to the country that they were visiting and got out of their train, her donor was standing right in front of her.
Wow.
So she had spoken to her donor before, but she had no idea that her husband had arranged this.
Oh my goodness. What a special guy.
I know. It gives me goosebumps every time I tell this story.
Oh, did somebody video this? I hope.
I want to say her story was like on CNN.
Really?
They did a short clip. I'm pretty sure.
Oh, I'd love to be able to see that. That's a wonderful story.
Can I tell you another story?
Sure.
I love telling the stories of when our patients meet their donors through the donor registry. So we had a gentleman who was a fireman, same scenario, had leukemia, got diagnosed, had to use a donor through the National Donor Registry. His wife was his caregiver. He had an extreme amount of support, which for patients to have it, they're very lucky when they have an extreme amount of support. So his story is the same as my other patients. once he finished through his transplant process and was in a remission, he had young children, and one of his children's schools, an elementary school, asked for him to come and speak about who is my hero. My patient walks onto the stage, and there's about 10 of us coordinators standing in the back of this elementary school cafeteria. He has no idea we're there. So he got on stage, and I think it was like Hero Week at school. He was the main speaker at the program, and he got on the stage and said who his hero was. And his hero was his donor that he had never met before that lives out in Europe. So he gave this speech, and then all of a sudden his wife comes out and walks on stage and says, well, today you're going to meet your donor. And this tall gentleman, who's probably 6'4", stands up in the crowd and waves his hand. And it was just,
wow.
Again, it was an experience I will never, ever forget.
I bet. I can picture it.
It gives reason why we do this.
Yes.
Why we do this every day.
Yeah, I agree with you, Anastasia. The people that I get to meet in this job, they will be in my soul for a lifetime. It's very special work.
Yes, it is.
They work so hard to get through transplant.
They do.
Live their best lives. And these are just incredible stories. Thank you so much for sharing that.
You're welcome.
Yeah. So anything else you want to cover today?
I think the biggest thing is, again, just stressing the importance of not only are we here for our patients, but we're also here for our caregivers as well. And without them, I don't think that this would be possible. They play such a vital role, and our patients are very lucky to have support systems.
Yeah, we salute the caregivers today. They are just incredible people.
They are.
And it sounds like your team works really hard to set them up for success.
We do.
And that is very important.
When we meet our patients for the first time, we're already talking about what kind of support you have. Caregivers, we try to give our patients as much info up front as we can, because the caregivers as well, they have to plan ahead too. And it's become very hard when caregivers are working full time, and we have young caregivers too, young families who have children as well. So I think that can be hard as well, because not only do we require a caregiver for our patients, but we also have to have an additional caregiver for the children.
Yes.
Because that caregiver is solely for our patient.
Good point. And then you add on top of that the caregiver often holds the insurance. So they're trying to work while they're caregiving.
Yes.
So it's very complicated. And I applaud your hospital for doing all that you do. And I will mention, we have a caregiver book at the NBMT link.
Yes.
It's one of our most popular books. And listeners can go on our website, and we'll make sure it's in the show notes if they'd like to have access to a copy of our book.
Okay.
Well, thank you, Anastasia, for being with us today. This is such an important part of this season, the clinical part of caregiving, the support that you offer. Thank you again and again.
Oh, you're welcome. It was my pleasure. I want to really sincerely thank you for having me as a guest here today, and just the opportunity just to speak about how they can contribute and engage in this topic, honestly, that is just so close and dear to my heart.
Yes, I can tell. Your patients are very lucky.
Thank you.
And their caregivers, of course.
Yes.
Thank you.
Thank you.
This has been the Marrow Masters podcast. Please share this episode with someone you think would benefit from it. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple, Spotify, YouTube, or wherever you're listening right now. Marrow Masters is produced for the National Bone Marrow Transplant Link. Established in 1992, the NBMT Link strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow transplant from diagnosis through survivorship. The Marrow Masters podcast is produced by Jag Podcast Productions online at jagpodcastproductions.com.